Hi, let's review the atrial conduction system. Well, the chief pacemaker site of the heart is the SA node located up in the right atria near the coronary sinus. That's why it gets its name, the SA node, sinoatrial node. And the conduction pathway of the impulses travel down through the internodal pathways, as you see pictured above, until they finally reach the AV node. This allows both atria to pump their blood into the ventricle, thus the importance of the AV node, which we'll come to next. The AV node is located on the floor of the right atria. It acts as a gatekeeper. It can also act as a backup pacemaker should any impulses in the atria, more specifically the SA node, fire. Now remembering the SA node has an intrinsic rate from 60 to 100. That's where we get our normal intrinsic rate for the SA node is a sinus rhythm if the rate's between 60 and 100. Greater or slower is a tachycardia. Same thing for the AV node. Its intrinsic rate is 40 to 60 beats per minute. Moving on to the ventricles. The impulse moves into the bundle of His, and then it breaks up into the bundled branches, the left and right. The Purkinje fibers are specialized electrical conduction paths that conduct the electrical impulse through to the ventricles, and it has an intrinsic rate of 20 to 40. The left bundle branch is broken up into the anterior fascicle and a posterior fascicle. Remember, the SA node has an intrinsic rate of 60 to 100. Anything faster than 100 is sinus tachycardia. Anything slower than 60 is sinus bradycardia. The intrinsic rate of the atria is about 60 to 80. The AV junction has an intrinsic rate of 40 to 60. So if you have a rhythm there and it's greater than 60, it's a junctional tach or a nodal tach, unless a nodal bradycardia. And then a particular intrinsic rate is 20 to 40. Thank you.